Hello, everyone. My name is Emily Bush, and this is Looking Closer Occupational Performance Analysis for Clinical Reasoning Development. The purpose of this video is to provide you a walkthrough of the clinical reasoning involved in the evaluation process from a student perspective. It's to provide an example of what entry-level clinical reasoning might look like and encourage students to critically analyze occupational performance to guide intervention planning as an attempt to increase perceived preparedness and confidence when entering upcoming Fieldwork 2 placements. About the creator. I am a third-year occupational therapy student here at Texas Women's in Dallas. This is part of my capstone project. I have created a pre-work lab module for your upcoming interprofessional experience event. The pre-work and this video is to help prepare you for the IPE event, thus helping you prepare for Fieldwork 2 placements. I have completed both Fieldwork 2 rotations. My most recent one was in inpatient rehab, and the one I had before that was outpatient pediatrics. Disclaimer, again, this is part of a student capstone project. The ideas, thoughts, clinical reasoning, and other information expressed are solely those of the student based on the real-world experience and knowledge gained from the classroom. Please understand that you are not expected to have all the skills demonstrated throughout this video. This video is created by a student who has completed their Fieldwork 2 rotations and now feels confident to share some insight and knowledge gained from those rotations. This video is to provide you an example of scenarios you may see in the inpatient rehab fieldwork setting. Your IPE event focuses on orthopedic conditions, and that is very common in the inpatient rehab setting. And because I just finished my most recent rotation in that setting, I really wanted to hone in on inpatient rehab. This is to provide a head start in realistically thinking like an OT. We always talk about what it means to think like an OT, so I really wanted to give you an example of what that may look like. This is also to provide additional information that may increase your confidence and your feeling of preparedness when entering your upcoming placements. Your role. I am going to provide you 4 different clips of activities a patient is performing. I really want you to observe and take in what was hard, what was easy, what is missing. So I'm using a pause and discuss format. I will be providing you questions throughout the video, and we will be talking it. You will have the chance to compare your observations with my own observations. Please record your observations, your thoughts, your ideas on a piece of paper or another device if you have it. I challenge you to use OT language outlined in the OTPF4 and think about the why. That's the biggest thing I want you to do throughout this video. I want you to think about why these skills are ineffective, what's missing. I want you to be able to observe a patient performing an activity and think, why was that hard? Was it pain limiting their mobility, pain limiting their range of motion? Is their core strength weak? Stuff like that. Okay, so I really want you to think about the why as you're observing. So let's begin. Again, the context is an inpatient rehab setting. Various diagnoses are portrayed through these videos. It's not really important what diagnosis is portrayed. It's more important on the observations of skills. Activities of daily living are really focused, so all the clips you see will be segments of these activities of daily living, which is similar to what you would observe during an evaluation process in the setting. So let's get started. has, here are some questions that I think are really important for you to think about. Answer these questions on your notebook paper or other device. So, what performance skills stand out to you? What looks difficult, and why do you think it was difficult? Do you notice any compensatory strategies happening? And what do you think they're compensating for? How can you help? What cueing would you have provided, and what interventions come to mind immediately? Here are my notes, my observations. She only uses one hand to perform her task. She only uses her right hand, and her left hand does not assist at all. She's leaning against the head of the bed to stay upright. She stands prematurely. The pants aren't fully over her feet before she stands up. Unsafe handling of the walker. She used the walker to pull herself up rather than pushing off from the bed. She nearly loses her balance several times. She does not adjust clothing on one side, and she terminates the task early. So, with these observations, I then start to think about the why. So, what is my clinical reasoning based on what I saw? So, with the only using one hand to perform the task and not adjusting clothes on one side, I immediately start thinking about maybe there's left sided neglect happening. Maybe she's not fully aware of her left side, or maybe there's something going on with her bilateral coordination. Bilateral coordination using both hands at the same time to perform a task. So maybe those are skills to work on. With the leaning against the head of the bed to stay upright, immediately I'm like, core strength. And this also goes with nearly losing balance several times. When you don't have a strong core, balance becomes a really big issue. With balance, everything comes from your core. So if you're going to work on balance, start looking at their core strength and what that looks like. So, core strength was the first thing to come to mind. Core strength is going to affect their postural control, staying upright. Maybe their midline control is a little bit off as well, not knowing where that midline is. And with the standing up prematurely and unsafe handling of the walker, I'm immediately like, safety. Safety awareness seems to be impaired. She seems like a very high fall risk with not pulling the pants all the way up. That's a fall risk because the fabric is now on the bottom of the feet, making it very easy to slip. In inpatient rehab, you always use grippy socks or non-skid socks, non-slip socks. And we didn't have any for the video, but keep that in mind. And then again, going back to the nearly loses balance, decreased balance. With terminating the task early, this could be a few different things. Maybe there's a cognitive aspect that we need to think about, but not necessarily. Maybe the patient got really tired, indicating potentially like difficulty with like impaired activity tolerance or endurance. Maybe it's standing tolerance. Maybe they got really tired in that standing position. So let's look back. All right, so let's take a look together. So there seems to be a lot of upper extremity strength to be able to push herself up into the upright position. So that is something that'd be really interesting to see the difference between her strength on her right and left side. So that's something you might want to evaluate. This figure 4 position that is difficult for the patient to maintain is really important for dressing, and we see it a lot. So some intervention ideas that come to mind is using like a Dyson slip to put under that foot in that figure 4 position to keep it up. She does a really good job of putting her threading the pants over her legs with one hand, which is pretty good. It's really important to note that there would be a therapist with her during the evaluation of lower body dressing, to have a gait belt, help her get up, give her cues to push off from the bed rather than using the walker. That's very unsafe. The walker could slide out from underneath you. So it's really important to know that that was a limitation of these videos. And then we saw that she plopped down. Maybe she was really tired, and that's why she terminated the task early. There could be a few different reasons, and usually your patient would be talking to you during this right, so we're going to pause again. These are the same questions I want you to think about. Jot down any answers, ideas, thoughts, interventions that quickly come to mind down. All right, here are my notes to compare yours to. So, my observations that I made note of were she has a very narrow stance when doing her stand pivot, unsafe sit to stand with walker. Her arms do a lot of the work. She takes very small steps. She's breathing very heavy throughout the task. She's looking at her feet the entire time. And she falls back into her chair rather than having a more controlled sit back into her chair. So here is the clinical reasoning, some thoughts that I had from my observations. So she has a very narrow stance, which can really affect balance. So that's something we really need to keep in mind. The small steps could potentially be due to pain, maybe it's a proprioceptive thing, maybe it's a cognitive thing. It could be a lot of different things. So maybe intervention ideas could be working on taking bigger steps. She uses her arm strength to compensate for potentially weight bearing through her lower extremity. Maybe she has some pain and she doesn't want to bear that weight on that lower extremity, or it could be due to lower extremity weakness. She looks at her feet throughout the entire task. And so, something I think about is using vision to compensate for that proprioception. Maybe she has a hard time knowing where her feet and legs are in space. And so, she's using her vision to really understand that. That's what's coming to mind. It could be she has a fear of falling. Um, could be that she's very concentrated on what she's doing. Decreased endurance and safety awareness comes to mind, especially when she falls back into the chair. She lacks that motor control to transition from standing into sitting. This can be very dangerous. So we really need to work on transfers and also wheelchair management, because what if the wheelchair wasn't locked? As you could see, it kind of flew back into the wall, even though the wheels were locked. So there's a lot of safety awareness topics that could be talked about. That falling back into the chair could also be activity tolerance and endurance. As we notice, she's breathing very heavy throughout the task, so she might be getting overly tired. This is something we want to target during our intervention process, working on that endurance, activity tolerance, and standing tolerance. So this is how I kind of uh, pick out my intervention ideas based on what I'm seeing. All right, so let's go ahead and watch this together real quick. One thing that I noticed that I didn't put into my observations or my clinical reasoning section was she's really leaning all her weight on her arms, and she has that pelvic tilt. This is going to potentially indicate decreased core strength. She's really having to work herself up in order to get into that upright seated position. So let's keep going. Again, because there's no therapist in this video, you have to keep in mind that you would be standing there helping with this transfer, especially on evaluation. You do not want to have them get up by themselves. You can see that one foot's kind of working more than the other. A lot of upper extremity strength is going into this. You'd be right there, so hopefully that wouldn't happen. But that falling back into the chair is something that happens frequently and is something that you really need to focus. Okay, we're gonna pause again. These again are the same questions, but go ahead and jot down the observations, your ideas, what you would cue, anything you noticed, and any intervention ideas that may have came to mind. All right, here are my notes. My observations: slouched posture, potentially. It wasn't anything crazy that I noticed with that. She put the shirt on the wrong way, it was backwards. She loses her attention to what she's doing at the very beginning of the task. Ineffective sequencing of donning the shirt. She puts the unaffected side in first. Pain limiting right shoulder movement. She uses the left arm to pull the right side of the shirt down, potentially due to pain. That's what it appears to be. So, my clinical reasoning: it appears she might have some decreased postural control, difficulty orienting the shirt. She would need cues to orient the shirt correctly. Maybe you could come up with some intervention ideas to help her remember, maybe some visual aids. Difficulty attending to the task. So she would probably need cueing to stay on task for different activities. Ineffective sequencing of donning the shirt, teaching her to put her the arm that's the shoulder that's in pain into the shirt first would make the donning of the shirt a lot easier for her. And overall, just pain limiting her movement and range of motion, particularly shoulder flexion and internal rotation. So those were some of the things that I noticed. Let's go ahead and rewatch the video together. All right, so let's go ahead and watch. So it kind of takes her a while to get started. The way she has the shirt oriented, it's going to go on backwards. Maybe she doesn't realize that. Messing with the fabric, that's something I've seen a lot, or getting stuck in conversation are ways that I see how attention might be impaired when doing a task. Again, she puts the strong side in first and the head first, which can work, but when the shoulder is in pain, it makes it a little bit more difficult. So she's obviously having a lot of pain. A lot of pain behaviors are being expressed. Pulling down the shirt, she can do it just fine on one side, but then she tries. It's not really getting it. But ultimately, she's able to get dressed. She probably just need some cueing and a lot of education on pain management would be helpful. And Okay, this is the last time we're going to pause the video, jot down any notes, use these questions as a guideline. Okay, here are my notes. So I have a lot of observations. So first thing, she turns her whole body and takes a step to grab the items to her right. She's leaning against the counter for support. She does have shaky hands. This could be for a multitude of reasons. Maybe she has Parkinson's, and that's just something that she has to deal with on a daily basis. Difficulty opening toothpaste. If you notice, she screws the lid off of a toothpaste tube that can snap open. She drops the lid. She misses the toothbrush when applying the toothpaste to the toothbrush. She has to take a seated rest break in the middle of the activity. Freezes before running the water. Maybe this is confusion. She doesn't wet the brush before brushing her teeth. Again, we talk about how everybody does different tasks differently. So this might be just how she brushes her teeth. So that is something you really need to know before you try to correct something like that. And she moves her head to brush her teeth rather than moving her arm. So, clinical reasoning, she might have difficulty with trunk rotation, decreased core strength with the leaning for support onto the counter. It could also be an endurance issue or a staining tolerance issue. Something to think about. With a difficulty opening toothpaste, what comes to mind is maybe a cognitive process that's impaired, or vision might be impaired. That is something that's very common in inpatient rehab as we're working with a lot of older adults. So maybe it's a vision impairment more than it is a cognitive process. She demonstrates decreased grip strength with dropping the lid, trying to get the lid open. It takes her a few attempts. Potentially difficulty with initiation for kind of like pausing to turn the water on. Again, difficulty with sequencing, but that's not something we should concern ourselves with if it's not an issue. And that's how she normally does it at home. And then decreased endurance, activity tolerance, standing tolerance. Those are things I think about with having to take a seated rest break, that leaning on the counter. So let's watch it together. All right, so let's go ahead and play the video. Okay, see how she takes a step to rotate her trunk? And that leaning, shaky hands. It takes several attempts to undo the toothpaste, and again, it's a lid that you can like snap up, but instead she works on unscrewing it. I mean, if it works, it works, but maybe that's a vision thing or a cognitive thing. All right, so she's really focused, but she misses the toothbrush completely. This is when she's like, oh, I need to take a break. Okay, and we're gonna move over to the next video, the next part. Okay, that lean in the head is a pretty solid indicator that they're tired. Getting up uses a lot of arm strength. This time she does get it. All right, see how she's like, I don't know, is that what's next? That's kind of what I'm thinking whenever I'm watching her. She ends up brushing her teeth anyways without the water, which again, who knows? That's something you're gonna have to like kind of talk to her about. What is interesting is how she doesn't move her arm to brush her teeth. She moves her head, and could this be because she doesn't want to lift off of the counter to brush her teeth? And maybe that's another indicator of like core strength or just overall endurance and activity tolerance. So, how did you do? Were you able to make the same observations I did? Was there anything I missed that you caught? Did you agree with my clinical reasoning or did you disagree with anything? And did you learn anything new? I really hope this video has given you a new perspective to consider when observing a patient and analyzing occupational performance. It really does become such a vital part of the OT process and the intervention process. Without it, it becomes so much more difficult to come up with the intervention ideas and plans. And this is such a core skill that we need as occupational therapists to be successful and help our patients as much as we can. I also hope you're walking away with at least one key insight that will strengthen your clinical reasoning and practice. I thank you for your attention and I thank you for following along with me. I hope you enjoyed. Thank you.